posterior part of the thigh will be described today. So this is the ischial tuberosity we will get here. You can see the posterior part of the femur, linea aspera, lesser trochanter, greater trochanter, intertrochanteric crest. This is the ischial tuberosity, where the ischial tuberosity will be divided into upper quadrangular area and lower triangular area. Out of that, again lower triangular area will be divided into medial and the lateral part. Medial part where the fibrofatty tissue is there, where you are sitting. During sitting, the weight is transmitted, and the lateral part where the distal part of the aorta magnus is attached, and the upper quadrangular part, which is divided into lower medial and upper lateral part. Lower medial part where both the biceps femoris and the semitendinosus is getting originated, and the upper lateral part where the semimembranosus is getting originated. So how those muscles are coming down and they are inserted on tibia, fibula, and the aorta tubule of the femur. We'll discuss that slowly. Here we will get the piriformis dividing this metastatic foramen, the upper part, lower part. So sciatic nerve is coming like this way in between this ischial tuberosity and the trochanter and coming down. The two components all will be discussed now. So here is the linea aspera, the lower part, the lateral supracondylar line, where upper part will get the attachment of short head of biceps. Here you can see the upper part of the linea aspera. Laterally, this is this rough area we can see gluteal tubercle, or the gluteus maximus is attached. This is the intertrochanteric crest, quadrate tubercle, or the quadratus femoris is attached like this way. So now we will slowly discuss about the muscles of this compartment, which is the main four muscles are there: semimembranosus, semitendinosus, long head of biceps, and aorta magnus ischial head. Once you have cut the skin, superficial fascia, and everything is cut, before discussing about the deeper structures, we should know the cutaneous supply. So cutaneous supply, here you have seen the posterior cutaneous nerve of the thigh, which is supplying the posterior part and this lower part. The medial part is supplied by cutaneous branch of obturator nerve, and this lower part is supplied by the anterior division of the cutaneous nerve of femoral nerve. This lateral part here, it is supplied by the lateral femoral cutaneous nerve, and this part is supplied by the posterior cutaneous nerve of the thigh, as well as this part. So this is the cutaneous supply of this posterior part of the thigh. The muscles are long head of biceps, short head of biceps, semitendinosus, semimembranosus, and below we will see the aorta magnus. This is the ischial tuberosity, which is divided into upper quadrangular and lower triangular part. The upper quadrangular again divided into lower medial part and upper lateral part. So lower medial part where the conjoint tendon of semitendinosus and long head of biceps is getting originated, and upper lateral part where the semimembranosus part is originated, and the lower triangular part again is divided into medial and the lateral part. Medial part will see the fibrofatty tissues there, and the lateral part where the ischial part of this aorta magnus will be originated. So this is the long head of biceps, which is coming down and getting attached to the head of the fibula just anterior to the styloid process. You can see here, you can imagine this picture. This is the upper end of the tibia and the upper end of the fibula, where this is the styloid process, and this part, the head of the fibula, it is getting attached. So that is the long head of biceps, and we can see here this is the short head of biceps. So just now I was discussing, if I am putting like this, so this is the lower part where the supracondylar line, this upper part of this supracondylar line, or the lower part of this linea aspera, here this area where the short head of biceps is originated, and you can see this area. So this is the short head of biceps, long head of biceps coming together and ultimately inserted on the head of the fibula just anterior to the styloid process. Now coming to this, and the muscle semitendinosus. So name itself is telling the lower part of the muscle is tendon like, you can see, whereas the upper part of the muscle is bulky. So both long head of biceps and semitendinosus, they are getting originated from this lower medial part of this upper quadrangular area, and this muscle is taking a turn medially, and now if you see this, so it is coming down and taking a turn at the posterior surface of the medial condyle, and after coming to the posterior surface of the tibia, it is coming to the upper medial surface of this tibia just behind gracilis and sartorius. So from anterior to posterior, first sartorius, then gracilis, then semitendinosus. In this way, the semitendinosus is getting attached to the medial part of the tibia. Now coming to this semimembranosus. The name itself is telling that some part of the muscle is membranous. The upper part of the muscle, you can see this, is the membranous part, and lower part is bulky part, just opposite to the semitendinosus. It is getting originated from the upper lateral part of this quadrangular area of this distal tuberosity. You can see this is the lower bulky part is coming down and getting attached to the horizontal groove of the medial condyle of the tibia. So that is the insertion of semimembranosus. Once it is getting attached to this horizontal groove of this medial part of the epicondyle, so this tendon is giving the 3 expansion here, fibrous expansion. The fibrous band extending upward and laterally behind the posterior aspect of the capsule of the knee joint and forming the oblique popliteal ligament of the knee, what we will see actually in the floor of the popliteal fossa, which we'll discuss afterwards, and one fibrous expansion that is extending downwards and laterally across the fascia covering the popliteus, which is the deepest muscle here in the popliteal fossa, the floor of the popliteal fossa, and the covering the popliteus, and it is going to attach the soleal line of the tibia, and some fibers also descending downward and for the attachment of the medial border, the upper part of the tibia behind the tibial collateral ligament. So in this way, the 3 expansions are coming at the insertion of the semimembranosus. Now all the muscles, they are all called hamstring muscles. They have some common property. They are all originating from the ischial tuberosity, except the short head of biceps, and they are all supplied by the sciatic nerve, whether it is tibial component or common peroneal, and they are all function the same. They are all the flexures of the knee joint and weak extensor of the hip joint. Now we will discuss about the sciatic nerve. So we can see here the sciatic nerve. Here is the piriformis. This is the obturator internus with two gemelli. This is the quadratus femoris. Here is the iliotibial tract, where maximum part of the gluteus maximus is attached, and 1/4 part is attached to the gluteal tuberosity. So sciatic nerve is the thickest nerve of our body, which is supplying the posterior compartment of the thigh as well as the leg. Sciatic nerve is having two components. One is the tibial component and another is the common peroneal or fibula component. The root value of the tibial component is the anterior division of ventral rami of L4, L5, S1, S2, S3, whereas the common peroneal part, that is the posterior division of ventral rami of L4, L5, S1 and S2. So many times we see these two divisions, they are coming through the piriformis muscle. You can see here, this is the whole piriformis muscle, whereas this is the fibula component, which is posterior, more posterior, coming through the piriformis muscle, and this is the tibial component, which is coming anterior to the piriformis muscle. Sometimes some variations may occur. This fibula part may come superior to the piriformis or posterior to the piriformis, and tibial part comes from the anterior to the piriformis. So here you can see the fibular part is coming in between the piriformis, whereas the tibial part is coming anterior to the piriformis. They are kept in a single shift and they are getting divided just upper part of the popliteal fossa, where you can see they are dividing to laterally, that is the common peroneal part, medially that is the tibial part. So this is the sciatic nerve, where surface marking, if you see, that is the posterior spine and ischial tuberosity. If we take a line, the midpoint almost 2.5 cm lateral, you can see that is the point where they are coming out. Then in between the ischial tuberosity and retrocenter, midpoint between this point, so that is the point, and another point is here just in the upper border of the popliteal fossa. That is the 3 points. If we can connect it, so that is the course of the sciatic nerve. When sciatic nerve is coming into the posterior part of the thigh, it is supplying all the hamstring muscles, where this hamstring muscles, semimembranosus, semitendinosus and the long head of biceps, they are all getting supplied by the tibial component, whereas the fibula component is only supplying the short head of biceps. Once we see the deeper relation of this sciatic nerve from top to bottom, you can see here. So here we'll see the two gemelli and obturator internus, then obturator externus will come below. This is the quadratus femoris, and we'll see the arrector magnus. So these are the muscles which are deep to the sciatic nerve, whereas superficially the gluteus maximus and the long head of biceps. And here you can see these are the perforator arteries which is coming from the anterior compartment to this posterior compartment. These are the perforator arteries. So we can see here how the ischial part of this arrector magnus is coming from this lower lateral part of this triangular area, and it is coming to insert on the arrector tubercle, and here is making a hiatus for the femoral artery and femoral vein coming from this arrector canal entering into the popliteal fossa. This muscle is coming into the hamstring group, but it is not inserted into the tibia, but actually the tibial collateral ligament, which is representing the degenerated tendon of this arrector magnus, which is continuous here up to the middle part of the tibula. So that is this tibial collateral ligament, which is the degenerated tendon of this arrector magnus. So that's why it is coming into the hamstring group. I am going to show you the arrector hiatus. So we have seen all the muscles already: sciatic nerve, ischiotubulosity, long head of biceps, semitendinosus. There is a membranous part, semimembranosus, bulky part downward, and here this is the ischial part of the arrector magnus. See, this is the tendinous part is coming down, and it will ultimately attach to the arrector tubercle. And if I am retracting this, you can see this is the hiatus where you can see the femoral artery and femoral vein. So this is the hiatus. I can put my finger, you can see I'm putting my finger. So through the arrector canal, like this, you can see my forceps, how it is coming to the popliteal fossa, the posterior compartment. So that is the arrector hiatus. From this side, if you see, so you can see here how the sciatic nerve is getting divided into fibular, common peroneal or fibular component, and the tibial component. And here you can see the femoral vein, then femoral artery, arrector hiatus. So that is the part through which, from the arrector compartment, the femoral artery and vein coming to the popliteal fossa. So once we discuss the popliteal fossa, then we'll see the structures and relations. So this is the sciatic nerve. All the muscles, the medial side, is supplied with the tibial component. So this is the tibial component. And this part is the fibular component or common peroneal part, which is supplying the short head of biceps. Okay, so this is all about the muscles of posterior compartment. Thank you.